Got
Welcome
it.
to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today we have Dr. Ron Torrance with us. So welcome, Ron.
Hey, we're matching today. We're both black on black.
I know, awesome. I'm so excited for us to have a chat here. So Ron and I have known each other for quite a long time. We've been working in the community, I don't know, 5-6 years, maybe. Yeah, so you came to St. Pete when?
So I moved from Philadelphia after completing my training in August 2017. So we
Okay.
are fastly approaching my anniversary.
Wow. So then it was around that time because at the time I was working with Dr. Lieber and you joined his practice and you've got an extensive background in orthopedics, sports medicine, osteopathic medicine, and also family medicine and urgent care, as well as functional medicine. So I know that you have combined a lot of those things and have been with Regenexx for a while. And you and I work a lot together because for me, I'm looking at whole body healing. And for you, you're keeping people out of surgery, which I love. So why don't we just jump in and why don't you give the listeners a little background about you and your training and about Regenexx and your practice?
Yes, thanks. I've been privileged and blessed to be able to work with such great professionals like yourself, and I'm super grateful for that. And Regenexx at New Regeneration Orthopedics is really my passion and combination of everything that I love to do. Our mission and goal is to get you back to doing what you love by doing what we love. We do orthopedics, non-surgical orthopedics, and that's our mission and goal. And I'm going to try to figure out any way possible. And by working with quality physical therapists and quality team members, the orthopedic model is a team model. And that's something that we really, really try to emphasize in our practice as well as in life. And if you practice what you preach and you do what you do, you're going to get people better. And that's really what I love by working with Back to Normal and Lisa and her team. And I've been super blessed to be in this position, and I've been doing it for a little over 6 years now.
So how did you, so you started off as an osteopath, right? You went through osteopathic training. So what took you down this path to get into the regenerative medicine side of things?
Great question. So during osteopathic physician training, we did hands-on work, and that's something that when you do MD, medical doctor, or DO school, they're both now same residency programs. And when you do those programs, MDs do a lot more research. I'm going to be completely honest with you. I feel like they do a lot more research in their training. That's kind of one of the adjuncts that they do. We do a lot more hands-on work. And a lot of times that kind of lends us to an orthopedic sports medicine side of things. During that training in medical school, I worked with Dr. Lieber, my now partner and colleague, and he really introduced me to utilizing my hands and utilizing, manipulations to really help people get back to, doing what they love. And I found it just something that came natural to me. If you're listening to this, I'm 6'4", 215 pounds. I'm not a small man. So it's one of those things that I have a predisposed ability to utilize my hands and my body to help manipulate or use muscle energy or something to help patients. And so fast forward, I went to a surgical internship, was looking to do orthopedic surgery, and that ended up not working out. But I think it was fortuitous because I found this path, and I'm super grateful for finding the path that I'm in. And I did a sports medicine fellowship, did a mini spine fellowship during that sports medicine fellowship, and ran into Dr. Lieber at a conference, and he invited me to come by his office. And from that point on, I really got exposed to regenerative medicine. And what regenerative medicine is essentially utilizing your body's own cells to heal itself, and by using guidance to make sure we're putting it in the right place. And I think that those are some of the biggest tenets here of regenerative medicine and successful regenerative medicine. And that's by utilizing the guidance and making sure you're finding the root cause of the issue. And by treating the root cause of the issue and working with a quality team for rehab and correcting movement patterns that might have caused the issue, you can get somebody back to doing what they love. So I think that answers the question.
Yeah, no, for sure. And and I could definitely say all the years of working with you and Dr. Lieber and Dr. Pappas, and that whole Regenexx team, there is a definite difference in when they have those procedures. I think because of your expertise and how you really are looking at the person as a whole, and that is predominantly what you guys do. So that is where I feel completely confident, referring to you guys, and then together we've really been able to help patients where they might not be responding to what we're doing in therapy, but your different procedures can definitely get them over that hump.
Mhm.
Yeah, for sure. Okay, well, let's kind of jump in. Now, you also are a CrossFitter and you played pro volleyball, right? So you also come with a background of athletics and sports. So talk a little bit about that experience and how that's impacted your practice.
So since I can remember, I've been involved in sports. My father played semi-pro baseball. My mother was always playing. She's in the Hall of Fame at Penn State Barron. It's a small D2 school in Erie for volleyball, basketball, and track. So I grew up in a very athletic family, and it's something that it was always something that we were doing something outside and doing something active, and that was our family's MO, and that's what we've done since I was a kid. So I don't really know anything differently than going out and working out or running or doing things. And so CrossFit was something that just kind of came to me because my dad introduced me to Olympic lifting when I was like 14. And he wanted me to be the best athlete that I could be. And doing sports got me my D2 scholarship for baseball and helped me get my double bachelor's of science in chemistry and biology. And so that's what kind of also taught me how to use time management skills, taught me to do a lot of things that are really difficult to teach. It's something where sports just drives that into you. You have to manage your time wisely. Otherwise, you're not going to be able to get done the schoolwork that you need to get done to pass your classes. So growing up, it's just, it was ingrained from the beginning. We were going to do sports. I played baseball, basketball, football. I played soccer at some points. I played roller hockey. I mean, I don't think there's a sport golf. I don't think there's a sport that I haven't played. And that's really what I think pushed me in this direction for what I do. And I can understand and relate to a lot of patients who are an athlete. Everybody's an athlete in my mind, whether it's an industrial athlete where they have to walk 20,000 steps in a day. I had a person who works in a, I believe it was like an Amazon facility, and they're walking like 5 miles, 6 miles in a day, or even more than that. It's like 12 miles in a day. And I'm sitting there going, you're an athlete. You need to make sure you take care of your body just as much as those elite athletes on TV. Just because they do it for entertainment and you do it to make sure that people get their Amazon packages doesn't make much difference in my mind. And so we all need to make sure that we're doing what we can to continue to stay active and to stay mobile, and that's really how it's just kind of come to me from the beginning. So I think it kind of answers your question.
And I think that's great, and I love that. And you and I do a lot of community events together, especially with a lot of runners. But I think having that mentality. I worked in pro sports for many years as well, and having that understanding and that athlete mentality, I think really makes a difference when you're caring for patients. So, all right. So I'd love to hear your top 3 tips on how you get great clinical outcomes, right? Because not everybody does. And I know when I send people to you versus I send them to somebody else, the clinical outcomes, are different. So I'd love to hear from you on that.
Listen to the patient, number one, first and foremost. They're going to tell you 95% of the time what's wrong.
Yep.
And getting a good quality diagnosis and taking your time. I think that it's listening and taking your time on that, number one. I mean, it's really we have a luxury of doing an hour-long evaluation, and I take the imaging, I take the symptoms, I take everything together and try to figure out what really is happening that's causing that. And then Regenexx brings a superior injection product for what we do. And by understanding the science behind things and then utilizing that science the proper way and making recommendations based on experience, but also evidence-based medicine that shows what's going to work the best. That's another thing on how you get good outcomes. So one, I mean, obviously listening to the patient, doing a great diagnosis, workup, and making sure that you get all the information, like getting a dynamic flexion x-ray. I mean, not a lot of people even have ever ordered one of those. I ordered one of those the other day because this person was getting crazy symptoms that seemed like they're cervical generated, but there's been really nothing seen on their cervical spine. And I mean, it looks okay. I mean, but you know, and then she's never gotten a flexion extension or a dynamic x-ray. So if we're not looking in the right places, we won't find the right things. And so that's the first thing. Second thing, obviously working with our company, Regenexx, we really have the higher concentrations of platelets, which bring better results. A lot of the studies, one of the biggest issues, and I was sitting down with an orthopedic surgeon who was a chief resident of mine when I did my surgical internship. And he's like, well, how do you know the concentrations? I go, we have spin speeds and spin cycles that Regenexx has created to make sure that we're getting the right concentrations, and we have cell counters. We make sure that we have the appropriate concentrations that's going to drive the right results. And when you look at a lot of the literature, there's a lot of people doing, I did platelet-rich plasma. Well, if you just take blood and reinject it, it's not platelet-rich plasma. It's just blood, you know, it's whole blood. And so a lot of the PRP literature out there is poor literature because it doesn't have the concentration. So one, again, take the time with the patient, identify the root cause of the problem. Two, make sure that you're using the right injectate for the right issue, and making sure that you have a good concentration and that you're doing it the right way. And then three, I think, would be the image guidance, right? We don't do blind injections. I use ultrasound and live x-ray to make sure that I inject into the right areas. We do. I mean, I'm just going to say as general from our practice in general. And our practice shows that by doing guided injections with a proper diagnosis and then utilizing the best orthobiologic possible and the proper orthobiologic for the issue. I may tell you PRP when somebody came in to see me for stem cell. Why? Because PRP is going to work better for this issue versus that issue. And so understanding the literature and what works best, that's what makes really kind of the three things I think to make a superior outcome.
Yeah, I think that's really key. So I think I'd love for the listeners to have a better understanding of you know, PRP, bone marrow, these types of regenerative strategies that really can make a huge impact as opposed to like a cortisone injection, right? So talk a little bit about the value and what, you know, you've seen over the years in using these kind of injectables versus some of the traditional, which is what most people are familiar with.
So cortisone has multiple studies that show now that if you're injecting it into a tissue, a structure, it causes breakdown of that tissue or structure. Whether it's cartilage, it'll deteriorate cartilage, which predisposes you to have a joint replacement sooner. So just because something's covered by insurance doesn't mean it's good for you, okay? And that's my biggest issue with anything, right? I know that you're primarily working with patients outside of insurance. Why? Because if the value, you're giving them value. And a lot of times the insurance companies don't value the care that people are getting from their clinicians. To be completely honest with you, they just go, hey, listen, oh yeah, this is worth $30. You know, it's like, but true value adds and value-based care, you know, that's really where it's at. And so cortisone breaks down tissues, hurts structures, makes your bones weaker. 30% of people, 30% of women over 50, if they get an injection, it's a 30% higher risk for compression fracture, right? So if we're injecting a 50-plus-year-old woman with steroids, there's a risk for compression fracture, which is going to be worse in the long run. And so why would we inject those into somebody? Above all, do no harm. That was our Hippocratic oath. And I would venture to say that if we're doing steroids at this point, we're doing harm, and we should probably take it out of our armamentarium for injections. Platelet-rich plasma, orthobiologics. Platelet-rich plasma is your body's platelets. So if you cut yourself, platelets rush to the site of injury. Once they get to that site of injury, they cause a clot to form. There's some inflammation, and that brings your body's growth factors and healing cells to the area. 7 to 10 days later, the scab falls off. Your skin looks a little bit new. And then about 6 weeks later, it looks like you didn't even know it was there. Bone marrow concentrate is something similar. I usually tell patients that the cut makes sense for PR. So PRP, platelet-rich plasma, comes for cuts. But if you break a bone, you need a bigger gun. And that actually, when you break a bone, you expose the bone's bone marrow. So the bone marrow causes a callus to form, which then causes the bone to heal. Again, that takes about 6 to 8 weeks. So these orthobiologics are inherently in your body and do the healing processes for your body. Just now we're taking it, concentrating, and putting it in other places. So that's really in a nutshell, kind of my easiest way to describe these. If they're already working for your body, if you have a cut, if they're already working for your body, if you have a broken bone, why not use them in other places?
Right. It's just a natural way of being able to facilitate that natural, healing process for sure. So if somebody's listening to this and they're like, wow, well, I've got a shoulder issue or hip issue or whatever, and I'd like to explore this. What would you recommend? Like, how do they find an expert like you? Like, there are a lot of physicians, right, that are out there that are doing these kind of injectables. But just as, with physical therapy and any other kind of profession, right, there are those that really get great, clinical outcomes, and then those that are kind of dabbling in it. So what would you recommend to our listeners if they were looking to seek out somebody like yourself?
So the easiest way that comes to mind is if you go to Regenexx, Regenexx.com. There are location maps, and you can click on the one that's closest to you. We can always do a telehealth consult with one of our physicians here at our practice at Regenexx at New Regeneration Orthopedics. You can go to newregenortho.com, click on the link, and submit a candidate form, and they'll reach out to you and get you all set up for a telehealth. If you're outside of our area, just grab all your images from your clinician and we can give you some recommendations. If you're local, give us a call. Come on in. Come see us. We take most insurances for our evaluations. We want to do that so that we can get more people in to see us. And if they decide this is the right choice for them, then we can figure out the payment structure after that. But that's how we do things.
Okay. Excellent. Yep. And I would, highly recommend. One of the things I love when I send patients to you is like you said, you do a really great clinical exam and you use diagnostic ultrasound to help you identify the structures. So I think that that's also another, added value, that when you go to most physicians, they're not doing diagnostics. It's usually there's a algorithm that they have to follow because of insurance, and maybe they get an x-ray to start with, and they have to do a certain type of treatment before they can even order an MRI. And I know that what you can see, and with your skill of using ultrasound, that I love that you guys could do that right off, the bat. Yeah, for sure. So with Regenexx, why don't you just share why Regenexx, is kind of superior? You mentioned a few things in the beginning, but I think it's important for the listeners to understand, the backing of the Regenexx, brand and what that means.
So Regenexx has tracked outcomes for their patients since they began in 2005. So Dr. Centeno and Dr. Schultz founded Regenexx. And what does that mean? Well, we track our patients. You come in for a procedure. If you leave, you'll get a follow-up email asking you, it's an independent email, asking you how you're feeling. And obviously we get the pre-treatment score first. So say you have a 7 out of 10 elbow pain, And 6 weeks later, you have a 3 out of 10 elbow pain. So that's a roughly 50% ish improvement. And so we track patient outcomes. Then at 12 weeks, you're completely pain-free. So, like 7-3-0. So that's what you track. And then we track you after that 12 weeks. So it's like, it's day 0, 6 weeks, 12 weeks. I believe it's 6 months, 1 year, 2 years, and we keep following you after that. And so tracking the outcomes has really generated for us, we have 1,300 self-funded insured companies that cover our procedures. And because we've tracked over 150,000 procedures at this point, so we can demonstrate consistent results with most commons and most common because they're the most common. Lateral epicondylitis, one of the most common things that most clinical practices see. So we have the elbow pain. And that was what I was kind of describing. Hey, we did a common extensor tendon. You've got lateral epicondylitis. We do a PRP injection, one of the most studied. There's more studies on lateral epicondylitis with PRP than I think there are with steroid injection at this point. So because it works so well. And so that's one of the things that we track. We track our knee arthritis study. It's probably one of our flagship studies. We get about a 65 to 70% improvement for knee arthritis. So tracking outcomes has in turn had us link up with a lot of self-funded companies. What are self-funded companies? Essentially, self-funded companies are companies greater than 50 employees that have elected to self-fund their insurance. And orthopedic spend is one of the biggest spends for the self-funded companies. So what we do is we try to decrease the spend by doing an injection-based procedure versus a surgery. So our mission and goal is to help you avoid orthopedic surgery. And so our proven process and kind of pun is that we're your best shot at avoiding orthopedic surgery. So that's one of the things. So what does Regenexx bring outside of the corporate program? So Manatee County Schools, the Diocese of St. Pete, Marine Max, 7-Eleven, those are some of our corporate companies. We have 1,300 of them throughout the country. And I believe it's over 2 million to 3 million lives that are covered at this point. And so, all right, so what does Regenexx bring besides that? Okay, the tracked outcomes. Well, we have systems and processes. And I like to use a Starbucks analogy because there's a Starbucks on roughly every corner. And what does Starbucks bring? Well, if you go and get an espresso, a doppio espresso at Starbucks in St. Pete, if you go to get a doppio espresso at Starbucks in Philadelphia, if you go get one at a doppio at Atlanta, you're going to get that same burnt espresso from Starbucks. I'm not saying that their coffee is the best, but I'm saying that their systems and processes are very dialed in and that you're going to get the same result. Now, I'd like to think that our Regenexx PRP is much better than the burnt espresso. It's probably more like, your single origin, fourth wave coffee beans. If anybody knows that, I'm a big coffee nerd. So anyways, so it's super good coffee from a super good place, but our systems and processes are dialed in so that each of our clinicians delivers a very similar, if not the same procedure for each issue. Okay, so.
And do you have to go through a certain training or certification to become a Regenexx, provider?
Dr. Centeno hand selects all the clinicians, so that's a great question. Yes, that is true. So we had to be approved, and we have to take certain courses, and he has to sign off on those courses to make sure that we're doing things the way that he would like it done. So standardization of processes, systems, and clinicians, yes, all the above.
Yeah. And I think those are, again, if you're, looking for the best, you want to go to a practitioner who has been highly trained, has done a lot of clinical hours, right, of doing the procedures, is using the best product, and does this day in and day out, right? And doesn't dabble in it like predominantly maybe does surgery, but then does a little bit of PRP on the side. So that's one of the things I love about working with you guys, because I'm always confident that I know that they're getting a great exam, they're getting a great product, and you have the experience because this is what you do day in and day out.
And that's something I tell patients all the time, is that I did 2 to 4 bone marrow aspirations a week.
Yeah.
If you go to somebody else, they might do one once a quarter.
Mm-hmm.
I know who I'd go to. I'd go to the person who's doing these all the time because I know that they know what they're doing. And that's why, I send to somebody like yourself who knows how to do manual work, who knows how to do all these things, right? You want to send to the people that are doing it all the time because they're the ones who are up to date on the systems and processes, and also the most evidence-based medicine. So
yes, definitely it's a team approach, right? I mean, because if you do great injections, but you don't do great rehab to retrain the movements and, get them going on a good home program, things like that, then, it's not as great of an outcome. So for sure. Now, I wonder if you would like to just comment on the difference between kind of the bone marrow that you get from a person versus the, and you're injecting locally into an area versus systemic. I do get this question a lot, and I think it would be important for the listeners to have an understanding from an expert like yourself about the differences.
So what I'm hearing is that you want to know about the difference between like bone marrow into precisely guided into the right places versus like an IV stem cell type procedure.
Yes.
Okay. All right. So bone marrow concentrate has your body's stem cells, and that's in the United States. That's the most consistent way to get the highest concentrations. That's within the scope of practice of any clinician. If you want to get into litigiousness, we can talk about it. Message me, reach out to me. I'm here. So that's what we do. So we'll put the cells plus growth factors plus cytokines, because that's what bone marrow concentrate is. It's stem cells plus growth factors plus cytokines. And we will precisely put that into the right area so that area causes new inflammation. So inflammation for the first 48, 72 hours. And then it causes proliferation for the next 4 to 6 weeks. And then remodeling happens after that. Okay. We're looking for, if you're injecting a tendon, you're looking for tenocytes. If you're looking for cartilage, you're looking for chondrocytes to come in. If you're looking at bones, you're looking for osteoblasts, osteoclasts, osteocytes. And you're trying to get rid of the bad bone and get better bone in, or cartilage. You're trying to get good cartilage versus bad cartilage. And so you're trying to, by putting those cells there, you're bringing that in the right place. Now, I'm not in that space with IV stuff, but at this point, there are no places that I'm aware of that have really kind of shown evidence-based that you can. And now in the United States, you definitely can't just get stem cells and inject them in an IV. Reason being is that's creating a drug, and I'm not aware of any studies at this point of a drug that's injectable that is pure stem cells that can go into your venous tract. Now, you'd probably lose about 99% of that through first pass effect as it goes through your lungs. So not necessarily probably the best thing. You might get a little, if you have lung issues, it might help your lungs, but that's that. There are some offerings in Panama, Mexico, other places, because those are outside the purview of the United States FDA and FTC. So if you want to go there and venture there and get umbilical or placental stem cells injected IV, it's at your own risk. As a clinician, we're at higher standards. I won't do anything that doesn't have any evidence-based medicine backing it. People ask me about BPC 157 all the time. I've heard good things about it. However, there's no evidence besides on some rat models that show that it benefits patients, right? So our standards from, I'm double board certified, licensed in Florida, Jersey, and Pennsylvania. I have to uphold standards. Otherwise, my license can get revoked. So from my perspective, I don't know any studies that show that we can get IV stem cells that really cause a systemic effect. There have been some reports, but again, we need to do the evidence, do the work before we can start really kind of mass pushing that to the masses. And I know there was believe there's one study that looked at heart failure, and actually actually going through and putting stem cells into the myocardium. Heard about that study that had really good outcomes. It helped people with heart failure get more myocardial active cells. So we are still in we like to call it the Wild West. There are some people doing some crazy things. And I just, I'm not in I'm not in the Wild West space, because, I have I have my license and I'm double boarded, and I have my licenses. I want to keep my licenses. So that's where I'm at.
Okay. Well, great. Well, I think this has been very insightful. I know I get lots of questions on this, and I always try to do my best to explain, from what I've learned from you. But I think, hearing from an expert is always very helpful. So is there anything else of value that you'd like to offer to our listeners?
No, I just like to make sure if you're listening to this, you probably already know how great Back to Normal, particularly Dr. Chase, Danielle, the whole team is over there. But if you have any issues, please make sure you get in there to see them. And what I would say is, my wife says it best, is that you brush your teeth every day. You need something for fascial hygiene, and working with somebody from Back to Normal would be number one great choice, whether it's Pilates, whether it's just having some once every other week manual work. Maintenance is great if you want to keep your body up in the best functioning possible. You got to make sure you get in there and do something to protect. If you feel something, if something's bothering you, it's probably a little bit late. So why don't you get in there sooner than later? And so that'd be my kind of shameless plug to just make sure you get in. Preventative is better than when you're broken down. We live in a country that is all about sick care and not about health care.
Yeah.
And so we really need to start being better to ourselves. And whether it's yoga, Pilates, body work once a week, it's something that get some body hygiene, and you'll be better off in the long run.
Awesome. Well, we appreciate that, and we love working with you. So thanks for taking the time. I know you got a super busy schedule. So I will put all of your details in the show notes. So if they want to find you, they can absolutely do so. But thanks so much. And until next time, keep getting great outcomes.
All right. See ya.
See ya.